Well, good morning, everybody. Thank you so much for joining us today. Wanted to just remind you that if you're not already and you're not one of our speakers, to please mute your line.
Stephanie, you are muted.
I am not muted. That's weird. You guys can't hear me?
I can.
I can hear you.
Okay, perfect. Thank you for confirming. So any of you who have questions today, please put those in the chat box. We will ask questions at the very end of all of our presenters. So all you need to do is type those in as you think of them, and we will ask them, like I said, at the end. If you miss any portion of today's program, it will be available on YouTube. Okay, and in just a moment, we're going to introduce our Economic Development Director. Just get that slide going. Okay, it is my pleasure now to kick things off today by introducing Jessica. Yes, Jessica Gonzalez, the Economic Development Director for the City of Corona. Take it away, Jess. Uh-oh.
I think Jessica just stepped off the screen because her mic's not working.
She sure did. Let's
There she is.
All right. Welcome back.
Hey, everyone can hear me. I'm having a little bit of audio issues, but
Yes,
I do want to thank our partners today for putting forth this seminar. Certainly the Corona Chamber of Commerce for being our host for today's Zoom webinar, and also our speakers. We have our Riverside County Business and Community Services. We also have the County of Riverside Environmental Health. We have the Small Business Development Center and the City of Corona all participating as panelists today. And we do understand these are tough times for our restaurant community. And certainly as you're looking forward to guidance in terms of how to reopen safely, how to conduct operations in an inviting manner, today's panel of speakers will be able to share that information with you. So I hope that you enjoyed, find beneficial, and really here the partners will be able to provide that guidance that will be needed for your long-term success. Thank you.
Okay, and with that, we will introduce our first speaker today, Rob Moran with the County of Riverside.
Thank you, Stephanie, and thanks, Jessica. And I just wanted to say before I wanted to share a couple of programs with you, but I wanted to say that the County of Riverside, and I'm sure I'm speaking on behalf of our partners at Environmental Health, we're pleased to be partnering with the City of Corona and the Corona Chamber of Commerce and the Inland Empire SBDC. We're all united in this effort to help support our business community during this, the most unusual of times. So know that if you reach one of us, you're reaching all of us, and we're all aligned and united to work together. So appreciate the partnership. And as I said, there's a hefty agenda today. So I wanted to share a couple different programs with you. One is our business grant program, and then our business ambassador program. So if Stephanie, if you could move to the presentation, really appreciate that. I don't know if you can hear me. There we go. All right, so the County of Riverside has had a COVID-19 business assistance grant program for the last couple months, started in June. And I want to emphasize, when I say grant, means you don't have to pay this back. And it is designed for small businesses with less than 50 employees, including sole proprietorships. And we've had 2 rounds and have funded approximately $34.6 million to date. We will be opening our 3rd and final round tomorrow morning. And the basic eligibility that we've had previously remains the same, but we've lifted the restriction on businesses that have received PPP, Paycheck Protection Program loans, and or forgivable grants for those businesses that receive $75,000 or under, which is approximately 87% of those that receive PPP in the county. The application period starts tomorrow morning at 9 o'clock and is scheduled to run through October 30th, but I can tell you funding is limited. So if you're interested in applying, apply early, because I'm almost 100% sure we're going to run out well before October 30th. So they're awarded on a first come, first served basis. So I encourage you, again, it starts tomorrow morning at 9 o'clock. Next slide, please, Stephanie. And so I just wanted to go over some of the eligibility. I'm not going to go into super detail on each one of these. But essentially, you need to be a for-profit business. If you are a nonprofit, there is a nonprofit program that is run through the Inland Empire Community Foundation. And of course, be able to demonstrate business impacts from COVID-19, which is pretty much the majority of businesses in Riverside County. Important to emphasize that if you are located within a city, within the county, you need to have a current business license. Pretty much most cities have been renewing, and I believe Corona is one city you can do it electronically. So make sure you have your business license. That's an important requirement. Next slide, please. A couple other, criteria as well. Be in good standing. There are some business types that are not eligible. This is federal CARES Act funding, so it is limited. Again, we have a nonprofit program, so if you are a nonprofit, you can access that through a different portal. And then certain types of businesses, cannabis related, adult entertainment, etc. Next slide, please. And we often get asked what are the eligible uses? What can I spend the money on? And these are just a few of the examples. These are not the only ones, but pretty much anything that's related to running your business as a response to COVID-19 impacts are pretty much eligible. At the end, if you receive the funding, you're going to be asked to kind of justify what you got and do some pretty minimal reporting. So it'll be helpful to kind of keep track of what you spent the funds for. It's not complicated in any way, shape, or form. Next slide, please. And to apply, you're going to need to have, again, I mentioned the copy of your current city business license, and then your financial income statements, tax returns from last year, just to show that you are a business that has been operational for at least a year since March of 2019. And then there's a couple things, next slide please, Stephanie, that you'll be asked to do during the application process. It is, and by the way, it's all done online at rivcobizhelp.org. You can see the link at the bottom of the screen in the blue banner. You'll do a grant agreement. It's just a short agreement saying that you're going to spend the money on these things. We'll be asking you to do a kind of a checklist, a safe reopening plan, and then a W-9 form and an ACH, because the funds are transferred electronically. So you'll want to have your business banking account or the bank account you use for your business in order to upload the information. And lastly, if you have any questions, in the last slide, please, Stephanie, you'll want to, apply at the portal shown, and you can email any questions. You can also reach out to the Business and Community Services Department. Feel free to ask us any questions. Again, application period starts tomorrow morning at 9 a.m. The second program I wanted to share quickly is our Business Ambassador Program. And this is a program that is designed to help businesses kind of maneuver the reopening and state guidance on how to operate in this COVID environment. And we started this in July, and we're almost at 100 businesses that we visited. It is a no-cost consultation that the county provides to understand how to maneuver the state guidance, what you should or maybe shouldn't be doing in the operation of your business. We give you some masks. You can take the Greater Together, Safer Together pledge. And we'll bring a toolkit that shares other business information. But what we want to do is help you navigate the, sort of the complex state guidance that has been ever changing. And it can be difficult to understand and even more difficult to implement. And again, we'll come out to your business. We can do it, again, in person. We can do it on the phone, or we can do it virtually. So if you have a simple question and you just rather, give us a call, we can do it that way too. And Stephanie, if you can go to the next slide and actually, go to the slide after that, and you can request the consultation. Go to our bizhelp.org site. And again, it's no cost. And one thing I want to emphasize as part of this consultation, this is done in the spirit of being helpful. This is not a regulatory visit, meaning that if we do notice something that isn't, operating in accordance with the guidance, we're not going to cite you. We're just going to share the information that's going to help you run your business in a more safe and healthy manner, not just for your employees, but also for your customers. And encourage you to take advantage of it. Again, no cost. You're already investing in these programs. And last slide, Stephanie just shows our contact information. Thank you again for the opportunity. I'll be here through the remainder of the webinar, and you can reach me after as well. So thanks very much, Stephanie. Thank you, Jessica.
Thank you so much, Rob, for that great presentation and telling us all about the resources that the county has to help our businesses and our nonprofits. Next up, from Riverside County Environmental Health Department, we have Kristen Lorge and Vanessa Lopez.
Excellent. Good morning, everyone. So we'll go ahead and just jump right into our presentation. Today, we'll be talking to you about the restaurant best practices during the pandemic. Next slide, please, Stephanie.
So some of the key topics we will be discussing in the next 20 minutes or so is to, one, provide a written plan, basically to prevent the spread of COVID-19. The second topic we'll be discussing is employee training and what that should encompass. The third topic we will be discussing is cleaning and disinfecting as far as the frequency and the proper type of sanitizers to be used. And the last topic we will be discussing is physical distancing. We all know to stay 6 feet apart. However, that is a challenge for restaurants, especially those who have smaller spaces. So we'll also be discussing some alternatives that you can look to do instead of the 6 feet apart. We can move on to the next slide.
All right, to begin, the workplace specific plan. So you want to have appropriate processes to identify the new cases of illnesses in workplaces. And when they're identified, work quickly to intervene and work with public health authorities to halt the spread of the virus. So one of those things that we're going to discuss is appointing a liaison, someone who's going to be in charge of the ever evolving changes of COVID-19 and the pandemic and all of the different guidance that continually change, having either a person or a team of people to be in charge of keeping on top of the information. Also, identifying contacts. So we're not referring to contact tracing if any positive cases result. We're more referring to the different government agencies that are going to be able to provide you with the up-to-date information. Also, training your employees. Like with everyday restaurant operations, training employees is key to success in any kind of a workplace specific plan. Finally, we'll talk about investigating the COVID-19 cases, working closely with our public health authorities to again halt the spread of the virus. Next slide, please.
So Kristen talked about appointing a liaison or some sort of representative to be the contact person for COVID situations. So their responsibilities in depth is to, one, perform a risk assessment of the facility. As a representative, that person will need to identify the highly touched surfaces, areas where physical distancing isn't possible. A lot of restaurants have walk-in coolers where those are confined spaces. So you might want to make it a point to have a policy that one employee may enter a walk-in at one time. Other areas where you want to avoid customer self-service. So if you do have soda machines or a condiment bar with salsas, you want to change your production. So instead of providing that, customer self-service at this time is closed. And what would you do? You would have to provide that upon customer request. Other responsibilities is to train the employees on COVID, and we'll go more into detail on what that training should encompass. The responsibility of that representative should make sure that the plan is working and that people or the staff and the customers are following the restaurant policies. And then as the situation is fluid and things do evolve, that person will have to reevaluate as needed. And then the last thing, and hopefully it doesn't come down to this, if a staff member does test positive, they will be primarily the contact person with public health to investigate COVID illnesses. I think we can move on to the next slide.
So here is identifying our contacts. So these are prime government agencies. We'll start right on top with Riverside University Health System. That is Riverside County's public health. This link is provided there. They're going to be the one that has all of our local information, press releases. You'll want to check that. The liaison would want to check that website often for up-to-date information. I mean, just yesterday they posted a new community city informational on COVID cases. It's very nicely done. So they're going to be the ones that will bring all of the any local orders that might be in place, as well as keeping up to date on things that are changing with here in Riverside County. Your next contact would be the California Department of Public Health. So, oops, sorry, if you want to go back to the previous slide. 2 slides back. Nope, 3 slides back. So the California Department of Public Health is going to be where you keep up-to-date information. That's where all of the orders come from the state. So they're going to post all of your guidance for the restaurant guidance, checking that often as the guidance does change. ABC, if you have a alcohol license with ABC, they also have their own guidance documents and state information. So that's their contact information. And then last but not least is our environmental health. So that's our contact information. So I do just want to really reiterate that we are not public health. So we would not be your point of contact for any kind of guidance as far as medical guidance, any type of information related directly with isolating employees or anything like that. That would be that top link, that would be public health. We are here to ensure that you know what the latest information is. So we're more of an educational at this point. We are regularly in your facility, so we've already established positive relationships with most of our restaurants. We're basically just here to help, to provide you with the information. The agency, while we're not the enforcement agency over any of the current orders, we can make sure that you understand them and help you implement those in your facility. Next slide, please.
Okay, so what we're looking at is actually the state website, and towards the end of August, California has changed to a 4-tier risk level. So I would encourage just anybody from the community to check up on the status of the different counties. The risk levels are based on the new cases per day, per 100,000 people, and also the positive tests. So as you can see on the left side, and this is just an example to show that I put Riverside as the county, and for the activity restaurants for dining in, and you get what the status is. And because we are considered the top tier to be widespread, that restaurants are only able to be open outdoors. Now, also on that website, you can see a map of the different counties. You'll notice that San Diego and Orange County are on tier 2, which is substantial. So as we're moving or improving our numbers, substantial will allow 25% capacity dine-in. And if our numbers tend to further along and do good, we'll go into the moderate and minimal levels, in which they do allow 50% dining in capacity. And that capacity is determined by the occupancy limit of the building that was set by the fire department. The county, and I received an email last Friday, is encouraging people to get tested for COVID-19 to help reduce the number of new cases, because I believe that for our positivity rate, we are below 8%, but in order for us to, as a county, to move forward, we need to have both numbers of new cases and positive cases below the threshold numbers. Okay, we can move to the next slide.
So this is a screenshot of our public health website where they post the daily testing numbers, also the positive cases, recovered cases. So this is just encouraged for everyone in our community to stay informed on what's going on locally. As I said before, public health did just update it with city and community data reports, which are very interesting to see. They're actually broken down by the city or community as well as your zip code. So the link is provided there on the screen for later use. Next slide, please.
So Kristen talked about our role. We're not the primary enforcement agency when it comes to COVID issues. We are conducting regular inspections for our restaurants and other food facilities, as they are still operating, as are we. And you want to educate your staff that when a health inspector does visit the facility, just know that we have our own internal screening procedures. You know, we do ask those general COVID questions, and when the inspector comes, they are wearing their face mask. And just like any other inspection, once we introduce ourselves, we'll go to the back of the kitchen and wash our hands before we start doing an inspection. Our main goal is to provide education to facilities and public. As you can imagine, public health is probably overwhelmed with calls. People do call us just because, you know, we go out there to do food inspections. Also, when the inspector does come for the inspection, just want to prepare your staff that we might ask questions too. For example, has anyone taken medication that might mask symptoms of COVID-19? Does anyone have household members with symptoms of COVID-19, or are they quarantined, or if you had any sick employees within the last 14 days? We do investigate COVID-related complaints. However, we're not the primary enforcement agency. Somebody will call our office to file a complaint. Typically it's, you know, employees not wearing their face masks. Sometimes we'll get a restaurant is opening their dining inside the facility. So we do follow up. Our first initial investigation would be a phone call to the facility, state, you know, what the current state orders are. If we do receive a second complaint, we will conduct an on-site visit. And then if continual non-compliance occurs, we do have to send our reports over to our county council. So that is our role. We are still out there and we are still doing inspections. Unfortunately, COVID is in limelight, but people still do get sick from regular foodborne illnesses. Okay, I'm gonna go to the next slide.
All right, so for training employees, like any other operational procedures at your restaurants, training employees is key in success. So you want to ensure that whatever the plan is that's been created, that plan is properly communicated with your employees. You can provide virtual or webinar, just like we're doing now, to provide social distancing, provide a written plan, ensure that it gets updated when necessary as things are ever evolving. And then following up to actually conduct your own audits to ensure that your staff are following those written protocols that you have in place, and identifying any deficiencies and making sure those get corrected. Next slide, please.
So topics you want to include for your employee training, basically information on COVID-19, how to prevent spread, how is it spread easily, and also those populations who tend to be vulnerable, the elderly, the immunocompromised. For self-screening, implement your own protocols for self-screening. You can either have the employees take their own temperature at home, making sure temperatures don't exceed the 100.4 degrees, or you can even take temperatures on site at the restaurants. And then just like our department, have those screening questions like, have you been sick? Have you been exposed to anyone who had tested positive for COVID? So all that you want to implement in your plan and also train employees. Stress the importance of not coming to work when somebody is sick. We pretty much know all the COVID symptoms, which is quite a lengthy list: cough, fever, difficulty breathing, chills, muscle pain, headache, sore throat, congestion, runny nose, nausea, vomiting, diarrhea. Those are all symptoms. And we would expect employees, even though if it's not COVID, to not come to work anyway when you are sick, because you can get other people sick. For PPE or personal protective equipment, you can decide whether or not employees should provide their own face coverings, or if you can provide that. Even for us, when we deal with customers, we do keep extra facial coverings to provide to the public if they don't have some for their own. It will also go into hand washing, physical distancing, and cleaning and disinfecting in detail in the next upcoming slides.
All right, thank you. So, oh, no, we went backwards. Next slide, please.
This is the last slide I have.
Oh. Then can I pull up mine and we can share my screen if we just give me 1 second. Sorry for this.
Kristen, you should be able to override me, but if you experience any issues, just let me know.
All right, thank you.
Mm-hmm.
See. All right, did that work?
Yes, we can see the first slide.
Yeah, so I'm gonna go through it here. Come on. Sorry, I should have had this already done. All right, so investigating COVID illnesses. So the liaison or your one liaison or your team will want to be in charge to slow the spread. If anybody is, just like Vanessa had mentioned before, if anybody does have any of the symptoms relating to COVID-19, as the person in charge, California Health and Safety Code does give you the authority to direct the employee to stay home if they have any kind of illness, any of those related symptoms. So you definitely want to make sure that employees are aware of those symptoms and following up with directing them to stay home. Hopefully they don't actually come to work and they just call and report that they are feeling ill. Even a single positive case among employees may quickly develop into an outbreak. So you want to do your part to just slow that spread and having these protocols in place. If you suspect that somebody is positive for COVID-19, you would want to contact public health. That is the contact phone number down at the bottom where it says Riverside County Disease Control. That's the phone number that you would contact. They will be able to determine if the facility needs to close. So that's not a steadfast rule. They'll be able to discuss the occurrence and evaluate the situation to determine if that does need to happen. They'll also work with you to inform you when that worker can return safely to work if they have been either on isolation or if they have a positive result. Public health will work with you to determine when they can return back to their normal daily duties. They'll also determine through contact tracing if others need to be isolated based on your occurrence. Every situation is unique, so that would be the contact number you'll want to have and keep for any type of potential positive or positive cases. Additionally, you'll want to determine if any work-related factors contributed to the risk of infection and update your plan if necessary. So next slide, please. Oops, that's me. So one of the key topics in your employee training is hand washing and glove use. So in the restaurant food industry, that is nothing new. So personal hygiene is one of CDC's top 5 risk factors for foodborne illness. So California Retail Food Code requires a 10 to 15 second hand washing procedure, while the CDC recommends 20 seconds. So going through training your employees to wash their hands for that extra 5 seconds to slow the spread of COVID-19. Also, doing your own internal observations to ensure that your food handlers are indeed washing their hands properly, using soap, warm water at least 100 degrees for that 20 seconds, getting the thumbs, the wrists, rinsing with cool water, and then drying their hands with paper towels. Experience has shown that physical distancing and frequent hand washing are key to preventing the infection. Also, keep in mind now that your staff are required to wear masks and face coverings, they will tend to touch those. We have observed that quite often and during our routine inspections. So training them, reiterating it, and then observing it for yourself to ensure it's a habit to touch those. And if they do, they just need to go back and wash their hands properly. So glove use and hand sanitizer. So the state guidance does talk a lot about glove use and hand sanitizer. So glove use is only required if your food handler has any kind of a cut or bandage. They need to wear gloves. Otherwise, we really encourage just proper hand washing. If you do choose to implement a requirement of glove usage, you want to make sure that your staff always washes their hands before they put the gloves on, and that they're changing those gloves just like you would wash your hands any time of potential contamination, switching tasks, just like you would do before. Nothing really has changed when it comes to hand washing and glove use. Everything's really pretty much the same. The sanitizer, having extra sanitizers or using sanitizer in addition, again, is an option. Maybe sanitizer for your non-food related staff is a good option to be able to prevent the spread, and making sure that that sanitizer is at least 60% alcohol based. If you do use gloves in your facility, you do want to be aware that latex gloves are not allowed. That was a new law that passed in the beginning of 2019. So you'll want to use nitrile, polyethylene, or vinyl gloves. Also, removing the gloves before they wash their hands. I know it sounds kind of silly, but that has been observed, and you want to make sure that they just never replace hand washing with the use of hand sanitizer, so it can be used in addition. Vanessa, did we lose you?
Can you hear me?
Yes,
Hello?
I can hear you.
Okay.
Yes, okay.
Sorry, my mic was on mute, so I had to unmute it. So for physical distancing, in general, the more closely a person interacts with others, plus the longer that interaction, the higher the risk of COVID-19. We all know to stay away 6 feet away, just because the spread happens when an infected person coughs, they sneeze, and even talks, the droplets get launched into the air and can get into the lungs of somebody who is nearby. I do want to point out, because we have received questions on this, if physical distance replaces wearing a face mask, it does not. So we do expect employees, even when they are working alone in like a prep area, to properly wear the mask, making sure their nose and their mouths are properly covered. Next slide. Okay, so for physical distancing, it's a good idea to add visual cues, especially if you are like me and I'm not good at measuring distance. I personally do like those visual cues because of that reason. We've seen them everywhere. They're all spaced out. You can buy the stickers, or you can even use tape or some sort of other marker. One thing that I do notice for some facilities, and if you're lucky to have an entrance or multiple entrances, restaurants will designate like a one-way traffic, so that people who are entering do not pass by those who are exiting. So I've seen that too. You want to encourage off-site eating when possible. Again, that's just to minimize a person's stay at the facility. Advertising takeout, delivery, curbside. Luckily, we have technology on our side for this to order online, and if you're picking up curbside, you can even just call the facility to know to bring your food out. For providing physical partitions, we've been seeing a lot of plexiglass, like you can see in that bottom picture, or some other type of impermeable physical barrier where physical distance isn't possible. So a lot of times we'll see this between the customers and staff, but think about your kitchen in areas where somebody is working in close proximity to another staff member. Designate specific areas to install those physical partitions when physical distancing isn't possible. I think pretty much luckily restaurants are set up that way. You know, you have the back of the house and you have the waiting section. So restaurants are pretty much configured like that already. And then think about if your kitchen, if you can change locations to where, like if the back of the house, you can designate prep areas where staff isn't exposed to multiple staff members, I would do that. Schedules for employee schedules, you want to stagger employee schedules so that staff does not congregate in the break room all at once. And then the last item, to prepare food in advance. So earlier we talked about salsa bars. So if you can fit prepping produce or condiments like salsas into those little containers, maybe you can change the employee schedules to where they can prepare that before operating hours, and therefore minimizing interaction with other staff members. Okay, you can go to the next slide.
All right, and the last key topic we're going to discuss is cleaning and disinfecting. So one of the things that your liaison will do is a risk assessment of your facility and identify those frequently touched surfaces so that they can be cleaned and disinfected throughout the day. So not only are they going to identify what surfaces need to be part of that, but when is that going to be done? So every restaurant will have their own unique plan. When are you going to have the additional staffing to be able to perform that extra cleaning? Who is identified to do it? How are you going to follow up to make sure that they are indeed doing it? Including in the frequently touched surfaces, You're going to want to include any kind of customer contact areas, so the tables, the chairs, any kind of condiment containers or tabletop items. So you also want to make sure whatever type of disinfectant, you want to make sure that it's EPA approved. That's the United States Environmental Protection Agency. So they're the ones that do the testing, and they set the level, the concentration, as well as the contact time. So later when this presentation is available to you, if you just click on the check it, that will actually take you to the list of disinfectants that you can put your disinfectant in that you're using by going and looking at the bottle, getting that EPA registration number, putting it into there on that link. It will take you to the EPA's website, and it will tell you what concentration to use and how much contact time. So you'll always hear us talking about cleaning and sanitizing, and now we're adding disinfecting. So how do all of those relate? So cleaning, any surface before you either sanitize or disinfect, it needs to be properly cleaned to remove any debris or grease residual. You want to just clean it with like a soap, water solution. And then your food contact surfaces, nothing's changed with that. So you'll still use your three-step method, the wash, rinse, and sanitize. Continue to use the sanitizer at the concentration with the contact time that you always have. However, the EPA, so there's a difference between sanitizer and disinfectants in the sense that disinfectants they undergo more rigorous EPA testing requirements, and they have to clear a higher bar for effectiveness than surface sanitizer products. So the registration number, you'll want to, again, check that website to make sure that you're using the right concentration and the right contact time. Luckily, if you want to just keep things simple and you're already using chlorine as your sanitizer for your food contact surfaces, chlorine bleach is also a disinfectant. So you can use the dilution of 1/3 cup per 1 gallon of water, and that is an effective disinfectant for COVID-19. Another thing that you want to add to your plan for cleaning and disinfecting protocols is making sure, especially now, to keep hand sinks stocked with soap and paper towels. Hand washing is the number one way to prevent foodborne illness, COVID-19, frequent hand washing and physical distancing. So.
Okay, we are at the end of our presentation, but I do wanted to address some frequently asked questions, and these are questions we get asked by the public and restaurants. So the first question is, do back of the house staff need to wear face coverings? And the answer is yes, because the state order does require all staff to have the proper face coverings. The only time would be if they're on their lunch break or eating occurs. Can I close my restroom to the public? If you are providing outdoor dining, you have to have a restroom available for customer use. The Health and Safety Code does state that if on-site dining, and that means indoor or outdoor, is provided, restrooms do have to be available. We now require all staff to use gloves. Is that okay? Glove usage or the use of hand sanitizer, just remember it does not replace hand washing. So you want to wash your hands as frequently as necessary, and the Health and Safety Code does require hand washing before putting gloves on. Is it okay to prop the door open to increase fresh air into my facility? We require the front and the back door to be closed because it's just an entryway for flies or other types of vermin to come into the facility. Can we offer self-service food? Not at this time per CDPH guidelines, so that encompasses soda machines, a condiment bar. If my staff can maintain 6 feet physical distance from one another and the public, do they still need a face covering? And we've gone over this before, but yes, the state order requires all persons to wear the proper face coverings. Okay, well, that concludes our presentation for the side of things. So I just want to thank all the attendees for participating and listening in, and also thank the City of Corona for putting this together.
Thank you, Kristen. Thank you, Vanessa. That was wonderful. We already have a question for you in the chat, so looking forward to asking that at the end. At this time, it is my pleasure to introduce our next guest, Jay Alice with the Inland Empire Small Business Development Center.
Okie dokie. My name is Jay Alice. I work with, obviously, the Small Business Development Center. I'm usually in the Riverside office when we're actually allowed in the office, but I have extensive industry experience, everything from a busboy to manager to executive chef. So kind of have an interesting perspective on things. So if you'd go to the first slide, please. So the first thing I want to talk about is, well, I just kind of went over that. Apologies. If you would go to the next slide, please. So the first thing is we're going to talk about customer experience. We're going to go over takeout and delivery, experiential dining, marketing, and financials. I don't want to get too far in the weeds with some of this stuff. Just suffice it to say that like Rob, when he mentioned that Corona has some help and assistance that they can help you out with in terms of how to deal with the crisis and pandemic with COVID-19 and how it affects your business. We at the Small Business Development Center also offer free services on a vast array of things, not only stuff concerning COVID-19, but also digital marketing and website development and financials and QuickBooks and in my case, a great deal of startup and permitting and a number of things. So we're all over the map and all of our services are free. So if you need any help, by all means, contact us. So if we can start with the customer experience slide. So just to piggyback on what Vanessa and Kristen were saying, a plan of action is going to be key. It is pretty crucial from a number of standpoints. I am a big fan of a written expectation, so a document that lays it all out for your staff because you want everybody on your on the same page. Also, I would highly recommend that to ensure that your customer or your staff has reviewed, either personally train them or give them a chance to read it and go over it, and then sign off that they have an understanding of what that material is. There's a number of reasons for it beyond what Vanessa and Krista talked about, but consider the liability aspects of things. You're complying with regulations and showing that you are doing everything that you can could potentially protect you from litigation down the road. When the CARES Act was initially discussed, even in the second round, and currently while they're doing their potential third wave of things, the liability and insurance protections have been hot topics of discussions. We don't know exactly how that is going to go, but suffice it to say that if you are on top of your procedures, it helps you a great deal if somebody decides to try and sue you for getting sick at your facility. So the next thing, waves and adaptability. There are different people in this world with different risk levels. You've got your high, your medium, your low, and everything in between. And here, as I can tell you from experience dealing with a lot of people when we opened up the first time, is the first people that are going to come back are those with high risk levels, those that don't mind the risk, you know, the black diamond, double black diamond ski slope skiers. Those people are also frequently a bit aggressive in their standpoint and want to complain about the fact that they're being required to follow certain expectations or rules. what happens is you get people not wanting to follow the rules, pushing you to change your rules to accommodate them. That's not a great idea, because the next level is going to be near medium risk level, who are going to be the people that want to wear masks all the time and are just, normal people wanting to get out there and experience life again. However, your low risk people are going to be those like, for instance, my mother, who is 85 years old and is a high risk person in terms of her pre-existing conditions and whatnot. But she's not going to want to go out. And when she does, she's going to expect everybody to follow the rules, not for their safety, but for hers. So adapting to that is going to be a tricky thing. Especially, and I'm sure most of you are aware, but the flu season is coming on. So we are getting into flu season. The coronavirus started in October, November of last year overseas, and really came on December, January overseas, and then found itself here. We're not too far away of October, November. So we're going to have multiple things going on at the same time, and it's going to be important that you keep on top of changes and risk factors, etc. So that brings me to door control. There are multiple ways to control this, but door control deals with not just your guests, but also your staff. As Vanessa and Kristen talked about it, setting up standards so that you are keeping your staff checked and following procedures, making sure that there's none of the symptoms or there's no temperature and stuff like that. Some facilities send out an email first thing in the morning, and it is your duty to respond to that email, yes or no, facing any of those risk factors or symptoms. But most small businesses are not necessarily that savvy. But when a staff member does come to work, having them sign a little, checklist to say that I don't have this, that, or the other thing is another way to limit your liability as well as keep accountability of your staff. Now, on top of that, you've got your clientele that wants to come in. And as we all know, right now, there is no real clientele inside the facility unless they're coming in to order or pick something up. And even then, frequently, it's outside. But we may, based on the waves or the levels, the risk, I forget exactly what you called it, but that really cool slide that you guys had concerning Riverside County and where we are on the risk levels, we might get into 25% seating inside again, which would be great, also considering we're moving into colder times. But how do you let those people in? I don't know if any of you have been to Costco or Home Depot or any one of these other facilities. I found myself at Ontario Mills, and it was really interesting because you could walk around, you could get in the facility just fine, but each individual store had its own door control access with various queues and people checking and stuff like that. Suffice it to say that checking your staff to make sure that the people that are under your control, so to speak, are following protocols, as well as the clients coming in are following procedures. You can do temperature checks, you can ask them all the questions, you can point to a sign like they do at the doctor's office. They check your temperature and point to a sign that with all the risk factors. And if you say no, you're good to go. But keeping on top of that is going to be crucial. I would recommend putting your hostess station or your door control outside your door, not inside your door. That way you don't have congestion inside in your foyer or your waiting area. It allows people to be outside, which is obviously better concerning this whole pandemic. Also, you're having people in and out, touching the door handle that you are going to be sanitizing, but if there's that much traffic coming in and out of your facility, it's not going to be sanitized enough unless there is somebody standing there sanitizing it after each use. Enforcement. I have literally talked to people that got yelled at for enforcing the fact that people needed to wear masks and sit 6 feet apart, or at not 6 feet apart, but the tables had to be 6 feet apart. And I talked to one woman who was in tears because she felt like she had to shut down after just reopening, and she couldn't afford to do so. She was stuck. She didn't want to upset her clientele, and she couldn't close, but she was afraid to stay open because of issues. So how you deal with enforcement is kind of a creative thing. There are a number of different ways to do it. Obviously, with your staff, it's really simple. You can send them home if there's any sort of issues. You can write them up. You can cut their shifts or minimize their hours, whatever you want to do. When it comes to your actual clientele, how do you go about it? You can ask them politely to leave. If they become too belligerent, you can call law enforcement. In today's day and age, there's also the social media aspects to it, taking a picture of them, banning them from the facility. But for instance, somebody comes into your facility, refuses to wear a mask, refuses to leave, they're COVID positive, they get other people sick. Now it turns into a contact tracing issue, and having documentation potentially of them in the facility is not necessarily a bad thing or an invasion of privacy. So it is your facility and you have the right to deal with it how you want to. That is another good reason to have your door control outside so that they don't create a problem inside. So outside dining, as Kristen and Vanessa talked about, is a very, very good thing right now. As a matter of fact, it's really the only thing right now. But moving forward, as you saw by that one cool slide, when we do go down in our risk level as a county or a city, occupancy inside the facility is going to be at 25 or 50%. We do not know how long that is going to last, and hopefully it won't last forever. I know that restaurants are basically a turn and burn type of industry where we want to get people in, get them fed, get them out, and then switch to the next table. So it's either that or you're a fine dining establishment where the experience is everything and you charge exorbitantly for it. So outside dining is going to be crucial. Obviously, you can do tables and chairs and pop-up tents and the like. There have been discussions about potentially having some form of tailgate where people pull up into specific areas, and instead of setting up tables and chairs, you can deliver to their car, so that almost like going to a Sonic. I don't know if everybody's been to a Sonic, but basically serving them in their car or at their tailgate kind of thing. But it brings up, how do you serve them? How do you deal with it? How do you do all of that fun stuff? And the main problem is make sure that if your servers are going to be outside doing this stuff, they're still following all your plan of action procedures, but your order taking and your payment are going to need to be done proactively versus retroactively, meaning you need to get orders and payments right up front, because if you're serving somebody in your car, obviously you don't want them pulling away and leaving. That would be problematic and do nothing but cost you money. We are also, like I said, starting to, even though it doesn't necessarily feel like it, especially with all the fires everywhere, we are starting to get into fall and winter time. We do not know how long this is going to last, so chances are outside dining is going to be with us through the winter. Southern Californians, it kind of cracks me up, but everybody, y'all get upset when it drops below 50 degrees or below 60 degrees and everybody gets chilly. So consider space heaters. Strangely enough, I'm from here, but I lived in Nashville, Tennessee for 25 years, and humidity and cold is far more prevalent there. So it's one of those things. But make it comfortable if you're doing outside dining. Obviously, you don't want somebody coming to your facility being told that they have to sit outside because there's no more room inside and you don't have any sort of heating or cover or anything like that for them. And that could be just a bad idea. So next slide, please. Oh, the last thing about outside dining as well as anything else is make sure it's cool with your city. Check your city for clearances before you do any of that stuff. The last thing you want to do is set up, make a couple of sales, and then be told that you have to pull everything down. But most cities are on board these days. So takeout and delivery. Industries, or rather companies and restaurants that have takeout and delivery are the ones that are doing far better than anybody else right now. I know there are a lot of businesses that are only doing outside seating, and they are struggling hard. Takeout and delivery is crucial, not just for now. Before, it was anywhere from 10 to 15% of your overall business, and at least until they opened up outside seating, it turned into 100% of your business. Bear in mind that this is going to stick around. It might not be 10, 15%. It'll probably go up to anywhere from 30 to 50% of your business moving forward. So having the ability to do takeout and delivery is going to be crucial. If you are not currently doing it, I strongly recommend that you take another look at it. So in order to do takeout and delivery properly, you're going to want to take a look at your menu. Not everything on your menu is good to send home or to put in a box and go. There's all sorts of temperature issues. You know, your hot items need to stay hot. Your cool items need to be cool. You know, you go to McDonald's and you get a hamburger and it has lettuce on it. That's cool, but even McDonald's recognized that if you leave your hot item, your burger and your lettuce on it in a container for more than 10 minutes, the lettuce starts to get soggy. And back in the early days, 20 years ago, of McDonald's, they had a container that had your cool stuff and your hot stuff. And, you know, your hot stays hot, your cool stays cool. It was a whole marketing campaign. They don't have that anymore because they just discovered that everybody is pretty much buying it and eating it right there. But you want to go through and make sure that your menu looks good, tastes good, and stays good in your containers. So if you have to use separate containers for items, that's great. It might increase your packaging costs a little bit, but your product is going to be, your product integrity and quality is going to be important. You're going to want to make sure that everything is properly sealed and packaged. You don't want to put sauce on everything. Oftentimes you want to put the sauce on the side so that people can do it themselves. Don't use a giant container where a smaller, more concise container will do. You'll have, in a big container, it's got much more room to move, and movement means that your product is not going to look as good when it gets there. It's just going to look like a jumble of junk. So consider stuff like a brownie with ice cream, you know? If you put a brownie with a hot brownie with ice cream on it and send it home, that ice cream is going to melt halfway before it even gets home, and then you're going to get a brownie with, you know, cream on it and some semi-frozen stuff. Or alternatively, like a French onion soup with a big melty block of cheese on top of it is awesome in the restaurant, but obviously you can't melt that cheese in a plastic or a styrofoam container. It just does not work. So take a look at your menu and consider paring it down to only offer, you know, your more high sales items, or adapting it so that your takeout offerings make more sense. So functionality, how do you make it work? You need to have a number of things. You need to have, like I just went into, solid packaging to make sure that it doesn't shift around. You need to have clear order taking. That is going to be a must. If you have modifications to your orders, it needs to be clear and properly labeled so that people are getting what they ask for. The last thing you want is to, how many times have you ordered a pizza for it to get to your house only to find out that they brought you the wrong pizza or didn't put the extra pepperoni or extra cheese, and you have to call back, and sure, they can send you out another one, but that's another half hour, or they give you a discount on your next order, but that's your next order. Long story short, you're not happy at the time. You might want to, like I said, label your items clearly so that you know what the specials are. You might want to have it all concise on a sheet tray so that there isn't a problem with mixing orders. You might want to put a specific person in charge and have a specific area up at the front of your restaurant for takeout orders. Whether that's inside or outside, that's up to you. Putting down good time estimates. So just giving the arbitrary, oh, it's going to take 15, 20 minutes might not be the best thing. Maybe 10, 15, because we're doing less business and our chefs are quite exceptional at pushing out food in a short amount of time. So, if they're putting in the order on site, that's no big deal. But if they're putting in a phoning in or emailing or using your website to put in an order, you might want to tell them, just come out and we'll give it to you. Other things is consider keeping your stuff hot in a hot box or in some sort of insulated thing or under a heat lamp. Because if you just package it, set it up, and then set it out on the front counter for somebody to come pick up, it's not doing anything but dying. And nobody likes that food. It starts getting into the danger zone, which Kristen and Vanessa are familiar with, and it just causes potential problems. So the better you keep your product, the better your customers are going to like it. So branding is another big thing. You've spent a lot of time, I'm sure, putting together your interior and making it up to your standards and kind of putting together what your restaurant is all about, whether it's time that you invested in your menu or your environment or anything like that. Branding is going to be very important to you because your brand is what your customers see and understand about you. Customer service is also incredibly important. That has to do with, how your clients interact with your restaurant. It is very important that you go above and beyond nowadays. You definitely want to keep your clientele and you want them to have a positive experience. So keeping any sort of problems away is going to be a big thing. So takeout and delivery, there's native delivery services, which are in-house delivery service, or there are delivery services. So I kind of put down a number of items on this. I am a bit of an advocate for native delivery, and here is the number one reason, which is delivery services, while easy to get on board with, charge a commission of 20 to 30% for your goods. So if you sell $100, suddenly they're charging your clients $120 to $130. You can use that money you can potentially increase your rates or have a delivery surcharge or something like that is considerably less and allows you to hire your own people. Hiring your own people brings your customer service back to you, not some random delivery Uber driver that is going to drop off your food and, quite frankly, honestly, probably taste it on the way. Your customers will appreciate all of your going over and beyond. You're accountable, your driver knows your food, keeps your branding in-house, you retain your employees, you can get basic insurance, and there's a number of ways to do this. Delivery services are easy. The service pays the drivers, but there's a 20 to 30% commission. They're already insured, but there might be gig worker issues based on new laws, etc. So if we would move on, if you'd like to talk more about that, obviously just go ahead and contact me and we can move on from there. So experiential dining, this kind of goes into the marketing aspects of things. So how do you sell more food? Ideas are package deals. In other words, putting together, I don't know if anybody's gone to Applebee's or Fridays, but they oftentimes have dinner for two where you get your choice of soup or salad, one of or two of a limited number of entrees, and then dessert for a set price. You can also put together family dining packages, kind of like think of the KFC family meal where you get a bucket of chicken and a bunch of sides for a set price. How you package your meals is entirely up to you, but there are a number of ways to be creative and give your clientele the experience of what looks like a good deal and something that's packaged just for them, something that they can take advantage of. So other ideas are theme nights. You can do music, costume, movies, etc. There's a number of restaurants that I've seen around the country that have the ability to project movies on the side of a building so that their customers can come and sit and eat and watch a bit of a movie. Having music might be an interesting thing. I know there's a lot of Hispanic restaurants that use mariachi bands, and having that might be something that you can do, provided you do so in a socially distanced and safe way. Simple things like costume nights. I mean, it's coming up on Halloween, and costumes are going to be a big fun thing to do. So you don't have to wait until Halloween to get it. So you can do food themes, Taco Tuesday, Fresh Fish Friday, Sushi Sunday, you know, whatever you want to do, Smoked Goods Sunday, that kind of thing. The whole idea is to be creative, keep it fun, give customers a reason to come to you, and be sure to include the fun in takeout, delivery, and on-site dining, okay? So marketing, these are a couple of quick ideas to help you get your marketing out there. So customer appreciation, handwritten notes, thank you notes, discounts on your next visit, something to say, hey, thank you very much for using us and thinking about us, and here, come back next time, and you know, a cup of soup is on us, or a free appetizer or something like that. It's a cost, I know, but to drive your business up where it is otherwise languishing is going to be a good thing. Website, get your menu online. My wife and I had a huge desire for sushi the other day, and we went to a place that I'm sure you are familiar with, but I won't get into where or what the name of the restaurant is. But long story short, they did not have their menu online. They had no website. I had to go to Yelp and look through 320 pictures to find their menu, their sushi menu in particular. And it was a big pain. I even called the place when I ordered and asked if they had an easier way to do it, and they said no. They were trying to get the owner on board. But find a way to get your menu online, whether it's on your Facebook page, whether it's on your Instagram and you're constantly pushing it out, your Yelp. If you don't have a website, I highly recommend you getting one. We can help you with that. But it is, if people don't know what you have to offer, other than coming in and looking at a menu, it makes it far more difficult to sell food to people who are just going to pick it up. So.
Jay, we'll have to do a 1-minute wrap up. I know this is a really great topic, but just to keep on track.
Yeah, I apologize. Everybody else went a bit further and longer than I anticipated. So I can just wrap up right now and say, let's just, if you have any questions, contact me and we can go from there. So.
We will make sure to provide these slides to the attendees as well, so they can read all of your great tips for their business. Okay, as you all can see, that his contact information is on the screen right now, and we'll be able to get that to you as well. At this time, it is my pleasure to introduce our next speaker, Jay Eastman with the City of Corona Planning Department.
Hi, thank you for having me. My name is Jay Eastman. I'm the city's planning manager. And I should start off by saying I am new to the city. So if you hit me with really hard questions, I may have to get back to you. But that being said, and just to avoid the confusion, I am the other Jay in this meeting here today. So if we have questions, make sure we're talking about which Jay we're going to. There we go, thank you. So I wanted to first start off by saying that, we here at the city want to assure businesses that we understand how difficult COVID has made things for them. A lot of times people look at city staff as bureaucrats, and we live in our communities, in this community, and we're not out at restaurants, we're not shopping either because places are closed, and we want things to go back to normal. So we are doing what we can, we are committed, and we are working with businesses to make adjustments to respond to the changes that are coming from the state. Next slide. So with that in mind, I wanted to clarify that the City Council took action on May 20th of this year, early on in the pandemic, to relax some restrictions that apply to the city. And the three specific actions they took here are to suspend enforcement of the amount of window signage covering that we currently, or our ordinance currently establishes. So if you need to put your menus in the windows, if you need to put phone numbers for people to contact you, things of that nature, the normal requirements for how much signage you can have in a window have been relaxed. The city has also suspended the number of banners that are allowed. So if you want to put up more than one banner advertising that you're open, what have you, you can do that. However, the location and the size of the banners still are applicable. So you cannot put banners on trees or fences. They need to be attached to the building. And you can't have a 500 square foot banner across the front of the building if it's not within the code allowance. As it relates to outdoor dining, the council took specific action to not require additional parking for outdoor seating. Our ordinance currently says that you need to have a certain number of parking spaces for based on the square footage of your building, plus additional parking for outdoor seating. And the city has taken the position that we're not counting parking spaces. So if you want to go and use a certain number of parking spaces in your parking lot, or just use a courtyard space or the sidewalk, the city is allowing for that to happen. Next slide, please. And so a couple things about the city council's action. One, they've relaxed the enforcement for until the end of the emergency orders, 30 days after. So this is not something that we have to keep going back to council and asking for. City staff is taking this seriously and trying to work with businesses to work within the ordinance or within public safety. I do want to be clear that the city is not able to relax non-city requirements. So county health departments, their criteria is for them to enforce. So the city, don't come to the city asking to waive health requirements. That's not within our purview. Alcoholic beverage control, ABC, they still have their criteria. You'll have to talk to ABC about what's allowed for alcohol sales in outdoor patio areas. And then, federal requirements, the Americans with Disabilities Act, ADA parking, all that still applies. And so the city has no authority to waive those. Next slide, please. So I think it's important to lay out kind of the foundation for what you need to do if you wanted to open outdoor dining and what the city would require. We are trying to make it as easy as possible. So first and foremost, you need to make sure your property manager or the property owner has authorized you to have outdoor dining. The city can't authorize you to put outdoor dining outside if the property owner hasn't said it's okay. Once you have that clearance, then you contact the city's planning department. I have the number here. I also have it at my last slide. It's good, it's wise. We recommend that you reach out to the county health department, alcoholic beverage control if you have alcohol, and make sure that you're getting all the good information from them that you need. Again, the city doesn't enforce those criteria, but we do recommend you reach out to them before you set up your outdoor dining. And then you would submit to the city a site plan and a dining plan, and I'll talk about what's included in that dining plan and site plan. Next slide, please. So there's really 5 criteria that we look for in kind of the broad sense of things. One, we do require that you maintain 4-foot wide path of travel on sidewalks. So if you're putting dining out on a sidewalk in front of your business, that 4-foot width needs to be maintained so that people in wheelchairs or otherwise disabled can pass by. And so that is a requirement that we look for. And other ADA compliance needs to apply. So if you're putting dining in a parking lot, you cannot do that in the ADA spaces, which are those ones with the big blue markings on them. But you can put them in other spaces. If there's spaces next to that and the property owner is okay with it, you can locate your dining in the parking lot. The ADA path of travel. So we do require under ADA rules that handicap and others with disabilities can get from the sidewalk to the businesses. And there are designated paths of travels with curb ramps, sidewalks, and things of that nature. Those cannot be blocked. Those need to be maintained. And then you still need to maintain access to your dining area for people with disabilities. So if you're providing a fenced-in area, you need to make sure that the entrance and exits to that space are wide enough to accommodate people in a wheelchair. The third point is to maintain your drive aisles for vehicles, and that includes emergency vehicles. So your main driveways and circulation within the facility need to be kept unobstructed. If there's someone that has a heart attack or there's a fire, we still need to get emergency vehicles through that space. And then if you are providing fencing around your outside dining area, you need to make sure that it's not blocking a line of sight for vehicles circulating in the parking lot. So if you're providing dining in a parking space right where 2 drive aisles come together, don't put up a 6-foot fence or other barriers where vehicles can't see through. Our main objective in all of our review is to ensure safety and make sure that we have access to the site in an emergency and that nobody's going to get hurt. Again, if you have alcohol, you do need to contact ABC, and we do allow for barriers to be put up. In fact, we require that we make sure that that's the case. If you're going to have alcohol, we just make sure that we review it and make sure that it's safe. Next slide, please. And finally, our fire department does review any plan that's submitted to us. They review canopies and tents, 800 square feet or larger. They look at the fenced area, they make sure that there's fire extinguishers, and they make sure that none of the access points have locking hardware. So those are the 5 criteria really that we look for. We do not charge a fee for our temporary review during COVID, so you just need to bring us the plans or email them to us. We typically can review them within 24 hours. Because it does require the review of both planning, building, and the fire department, that 24 hours is subject to the staff availability, but we've been pretty successful in getting that done. Obviously, if you come to us late in the day on a Friday, we're not going to be able to turn it around over the weekend because we're not here. But we may be able to, if we have a couple hours and people are in the office, we may be able to get it to you before the end of the day. But we are doing what we can to get those approvals. We do accept site and dining plans via email, so you can send those to us. We will review them and route them. digitally, and so that's fine as well. There's a phone number here that you can call, and what you want to do is ask for a planner. Just basically say, I would like the planner on duty, or I want to talk to a planner about outside dining for a restaurant, and they will put you in contact with someone that's available, and that person then would help facilitate your planning. Next slide, please. So I want to close by showing a couple examples of the plans that we've accepted. This is a site plan. This was done by an architect. It's basically an overlay on an aerial. And they've marked where the dining is going to occur, which is in a landscaped area outside their restaurant. A simple site plan. In fact, you can just take a Google map and mark up the location on the Google map as long as it's clear and legible. Next slide, please. Same business. This is the dining plan that was set. You can see the path of travel for ADA, those in a wheelchair. I want to clarify that this was done by an architect. We don't require that an architect prepare a plan. You can do it yourself as long as it's clear and has the information on it. And if there's information missing, we're happy to mark up the plan after talking with you on how you're going to operate to make sure that it complies. Next slide. This is an example of a plan that was done by a restaurant owner. This one did get marked up. This is not the marked up version, but this clearly shows what the intent of the restaurant owner was in terms of where their dining would occur, where their to-go would occur, and it gives us enough information that we can make sure that the public safety is being, that the safety of the public is being met, and that fire department has access to the building and facilities. And I think that's it for me. So this is my contact information. If you need to get a hold of me, the number you see here is actually the planning division phone number. So you can call them, somebody will answer and will direct you to a planner. If you want to email me, this is my email address, and I'm happy to talk to you. And like I said, I've only been with the city for a short while, but I've been doing city planning for a long time, and I can assure you that we're here to help.
Thank you, Jay, and thank you to all of our panelists today. Really great information was shared. Hopefully people can start implementing some of those tips right away and taking advantage of those resources available to them. At this time, we do have a few questions and comments that have been put in the chat. If you haven't had a chance to ask your question, please put it in there now. So the first question I have is for Kristen and Vanessa. How many restaurants have been cited for inside dining?
So I'll go ahead and answer that one. Overall, we're very grateful and thankful that the majority of restaurants have complied with the state orders and the local orders when they were in effect. So I don't have an exact number. I do know for our area, which goes beyond just the city of Corona, we've only had a handful of referrals over to county council. County council is doing their own enforcement, as well as ABC is doing enforcement, and referrals made over to Cal OSHA. So county council's in charge of those. I don't have a number, but the number that I do have is that the majority have been in compliance, and we really do appreciate that.
That's great. I have a comment here for Jay Alice. It says, this is in reference to delivery service by the restaurant. It says, if they have an employee doing this, they should check with their insurance carrier to ensure delivery is part of the coverage. It may be more money on their policy, and also verify with workers' compensation fees. Do you have anything you wanted to add?
Yes, that is true. However, there are services that your drivers need to be insured because their private insurance and your company insurance does not cover that. However, there are services that you can use that have access to temporary policies that can be as little as $5 a delivery. So on a $100 tab, that is 5%. So there are ways to deal with that versus big giant blanket policies that could be very expensive.
Great tip, thank you. This question is for Jay Eastman. Can handicap spaces be created to enable cover and dining outside?
Yeah, I think we could work with the building department to create a handicap space, but it does require certain signage. It has to be painted. It's not creating a temporary space could be difficult because we would be looking at it essentially as permanent. It does require that anyone getting out of the vehicle has a ramp and access to a sidewalk. So it may be more difficult than simply just putting up a sign. But I mean, as long as it meets the criteria, we can work with the building department to try to make it work. But yeah, that's possible.
Okay, great. This next question is for Jay Alice. Can you please provide some examples of best practices that you have seen on how to make the outdoor setup attractive to customers?
There are a number of different ways to go about it. I've seen people moving entire wait staff stations outside and set up a hostess stand. Like I said, I went to Ontario Mills and Rainforest Cafe, which has all inside seating, actually shifted it outside. They had a hostess and two servers outside dealing with all of that. Obviously, they would take their information inside to turn it into the kitchen, etc. But they basically had a small railing, since they do have alcoholic beverages, so an enclosed area, and they basically just shifted everything outside. You can do signage, you can do rails, you can set up your tables. Right around the corner from where I live, they have 2 pop-up tents and put up some of those wind/sunscreens, which actually looks really nice. And they serve in the parking lot. So I'm not sure, other than kind of dressing it up, exactly what you mean, but yeah, there are ways to deal with that. But having somebody on staff out there at all times is going to be important.
Great, thank you. This next question is for Kristen and Vanessa. In relation to, you guys had talked earlier about hand washing and glove usage. I think that the comment is that it's been noticed that people have been using gloves a lot more, and in doing so, they're kind of just using the gloves for everything when they're in the restaurant or the service industry. And how can they ensure good practices with glove usage specifically?
So proper employee training, training staff to, you know, as much as the gloves are not this magic barrier for contamination. So anytime they are switching tasks, changing from raw to ready to eat, any time that you would normally wash your hands, just training staff to take the gloves off, wash their hands, and then don new gloves. It's really just about employee training and following up and observing and pointing out to the food handler or the employee that, hey, you just switched tasks from this to that. You should have taken your gloves off and washed your hands.
Thank you very much. Those are all the questions that were put into the chat this morning. Thank you, panelists, very much, again, for providing your expertise today and for answering everybody's questions, providing these slides that we can get out to the attendees today. We have just a few announcements to wrap up with, and then we'll conclude our session. So for those of you who are not yet a member of our Chamber of Commerce, or if you know of a business that could find benefit in the Chamber, please connect with our membership specialist, Robert Yanez, and he will take care of you and chat with you about the needs that you have for your business. Next Thursday, the County of Riverside, along with the Corona Chamber, are hosting a Women's Leadership Conference. Men are welcome to this as well. Tickets are just $45. It is a virtual conference. If you use that promo code RECOVERY, that will bring it down from $65 to $45. And you can read about the speakers and the topics on the website at mychamber.org. We have partnered with Paul Webb, who is a neurolinguistic programming expert, to provide a series of workshops for sales in the community. And we are offering that through the Corona Chamber. It will be on November 5th, and it is free for members through the end of this month or discounted for non-members. Every Wednesday, the Corona Chamber hosts a business briefing on legislative updates and other topics of interest. Tomorrow, we will have a City Council Candidates Forum along with some updates from our county and our city. So make sure you register. The link is on the screen. It's bit.ly/CCBB-SEPT16. The following 2 weeks, on the 23rd and the 30th, we will also be diving in deep onto the California propositions that are going to be on the November ballot, what these really mean, kind of dissecting those for you. So it's free for members. Plan to join us, and you can see those on our website as well. This Friday, as the Chamber's Good Morning Corona program, we are hosting candidates from the Corona Norco Unified School District who will share with us their plans should they become elected. As well, we'll be having a presentation on creating a blueprint for recovery. So this is a perfect segue from this program into that as well, specific to your business. There is a promo code on the screen. If you use that, it's promo code Tuesday. You'll save $15 on your ticket today only. And that concludes our session today. So thank you everybody for joining us. You will receive an email with a link to view this recording later.
Jessica, did you want to stay on?
Thank you.
Thank you, Jay. Welcome to Corona.